Perfect. Um, welcome everyone to Himunicast. Today we have a very special guest. It's an honor to have him here in Chile. It's Dr. Moz Zhao. How are you, Dr. Zhao, Dr. Moz?
Very good, Hector. Thank you for having me, and also congratulations on defending your PhD. This is a huge achievement. So now you're also a doctor.
Doctor. Yeah, thank you very much. Thank you very much for our audience everywhere in Latin America and everyone that hears us in our channels. Well, basically, Dr. Moz Zhao, he's studying in Hong Kong first. He's a biomedical engineer. He then studied his PhD at Oxford, and then he moved to Stanford in California, where he's doing his research and also in on MRI topics, which we will discuss now. And yeah, so it's quite an honor to have you here and to talk to you. And
thank you for having me.
Yeah. And so first, I think we can start by asking you how's been your scientific journey and how it's been for you to move from different continents. Actually, you've been in Asia, you've been in Europe, and you've been in the States, and I have to say at the highest level of research and academy. So how's it been for you, this experience?
Right. Well, first of all, Hector, thank you so much for having me. And so I'm now just taking a few days off vacationing in Chile, and I absolutely love this country. And I mean, speaking of my scientific journey, actually in the beginning, I didn't plan or I didn't envision of becoming a scientist or a researcher. Because as you mentioned, in my bachelor's degree, I studied engineering. I just wanted to work, to find a normal job. And but fortunately, the opportunity came when I took a bachelor's project with a professor in my home country in Hong Kong. And in that project, we developed some interesting techniques to monitor the patient record, the electronic medical record system in hospitals. So that's how I was aspired to work in medicine or to apply technology in medicine. And then obviously later I continued to study for a master's degree in biomedical engineering. And then I also did some other interesting projects. And then I decided to pursue a PhD degree. Obviously at Oxford, my PhD thesis was on developing MRI techniques to measure perfusion or blood flow in the brain. And
so that's incredible. And how was were you already familiarized with the English language back in Hong Kong before you moved to Oxford, or did you learn it afterwards?
Well, I would say that
your English it's excellent. So
thank you very much. Well, I would say that I think this may be one of the benefits of studying or living in Hong Kong, because the society is bilingual, and in our universities, actually every lectures and every subjects were taught in English, and we had to do our homework in English. We had to write essays in English. But obviously, you know, in my spare time, I also took some other courses, you know, Spanish, for example. I can speak, yo hablo español un poco in Chile. And so, but yeah, but I mean, in general, I love, you know, learning different languages and meeting with different people. So I think diversity is very important in my career.
Great. And how did you did you get into Oxford? Did you apply in a particular way? Did someone tell you consider Oxford, or was it always in your genes to?
Well, I would say that, I mean, Oxford is very famous. It's very old. It's one of the best universities in the world. And I think the first encounter that I had with Oxford was from my English dictionary, perhaps. The dictionary was published by the Oxford University Press. So that's how I learned about this university. And fortunately, when I was looking for PhD studies, one of my mentors in Hong Kong graduated from Oxford, and he's now teaching in Hong Kong. So he inspired me to study at Oxford, and obviously, he helped me with the application and gave me a lot of good advice. And I would say I'm very lucky to get in.
Great. So and then your postdoc is now in California.
Yes.
And well, that was like a big step, a big leap across an ocean. How was that that change in scenery, and how has that impacted your life?
Yeah, I mean, you're absolutely right that I moved from England to the United States, to California, and well, the flight is always like 12 or 10 or 12 hours, and so towards the end of my PhD, I became increasingly interested in applying a lot of my techniques into clinical practice. As I mentioned previously, I developed a lot of like theoretical imaging techniques to characterize brain perfusion. However, when I was doing my PhD, I didn't have a lot of time applying these techniques on patient studies or on human subject studies. But the opportunity came when I met with my current mentor at Stanford during a conference where I, did a quick elevator pitch of my work for 2 minutes, and then ask him, what do you think about my project? And I think he quite liked it. And then he was also interested in some of the techniques that I developed. But obviously there were always in research, there's always more questions than answers. So so he invited me to visit Stanford. And we ended up having a wonderful time together, knowing each other. And then he offered me a position to be a postdoc there. And also I was lucky to have a fellowship to support my postdoc. So the fellowship is from the American Heart Association. So this organization supports research in cardiovascular and cerebrovascular diseases such as stroke and vascular dementia, things like that. So at the moment, I'm working on a lot of stroke imaging projects.
Yeah, it's actually your work. It's very interesting. I encourage everyone that's listening to Google Dr. Zhao. He has a lot of research papers, very interesting research papers. I've seen some on how's this arterial spin labeling. How's your work on arterial spin labeling being, and maybe if you could explain what it is to our audience. How does it work?
How does it work? Okay. Well, so yeah, arterial spin labeling, or ASL, is a non-invasive MRI technique that can characterize blood flow in the brain, or actually in anywhere in the body, quantitatively. So this means that whenever we do a ASL procedure in the MRI, we do not need any contrast agents. We do not need any radiation, radioactive tracers, obviously. And also, most importantly, the measurements of the blood flow is quantitative. So this means that the data we obtained can be used to study longitudinal effects in perfusion in the brain. And also this, since the technique doesn't involve any radiation or contrast agents, this can be applied to anyone. So yeah, any patients, children in particular. Obviously, there has been a lot of animal studies on ASL, and so I mean, I'm sure if you're interested in this, like the physics of the technique, it's basically just a little trick that uses the radio frequency pulse in the MRI to kind of invert or to label the blood. And then when it flows into the brain, we take an image. And then we take another image without doing anything. And then when we subtract these two images, the subtraction just implies the blood flow of the image or the region of the image. So, well, in short, this is the principle of arterial spin labeling. And but obviously, at the moment, I think it's available on most commercial MRI scanners. And yeah, I'm happy to talk more about it.
So and how is it very often used in clinical practice, or is this or is there a long way to go in using it in various things? How's the state of the art?
So yeah, that's a great question. I mean, obviously, we always want our techniques to be used on patients, to help diagnosis. Well, in our hospital at Stanford, as far as I know, it's been widely used on a lot of neuroradiology protocols. For example, in stroke protocol, we always have an ASL scan. So this can give us the blood flow information of the brain. And in AVM as well. So for example, if the patient has AVM based on their, I don't know, DSA images, then we can also use ASL to identify some very bright areas where the AVM occurs. We also sometimes use it after neurosurgery to make sure that the brain is safe, nothing has been damaged to the brain. And in my case, so I'm interested in studying the development or the treatment effects of certain neurological diseases. So I use ASL to do a longitudinal study on a group of patients with moya disease. So this is quite rare, but we have a lot of moya patients in our hospital, and then we follow them for the rest of their lives after their neurosurgery.
It's very, very interesting. Your work is amazing, and just for our audience to remember that many times these contrast agents that you're talking about can even produce allergies or that we have to be very careful with the kidney of the patient, with how it works and everything. Right. And so the techniques that you're working on are very important for the better care of patients, and it's amazing all the different things that will come out from your research. And
yeah, and one thing to add to the benefits of ASL is that you talk about the negative effects of contrast agents on patients with kidney failure, for example. But recently I read some very interesting paper that demonstrated the accumulation of, say, gadolinium contrast agents in the environment, in rivers, which pollutes our drinking water, because at the moment we don't have any ways to recycle the like the urine from our patients after their MRI exams. So over the years, the environment or near the hospital has a disproportionately higher concentration of gadolinium than any other substance. So at the moment, we don't know what to do with it, but with ASL, we can eliminate the needs for contrast agents.
Wow, that's incredible, an incredible concept. This is the first day I hear about.
Well, I'm happy to send you the paper, and then so it's so the study was not published on any like medical radiology papers. It was actually published on a paper that focused on like marine biology or water system, but it was nice to look at.
Since we're very focused on what happens in the hospital, and we have like that limit in our head of what is happening to these agents, and how is it going through the environment. So just to finish, to end this amazing conversation, just what maybe if you have an advice for future students, or for future scientists in the field, what advice would you give them to pursue their dreams and to pursue their passions in life?
Wow, that's very flattering. Well, I think, Hector, you can also give us a lot of advice from your very rich experience. Well, I would say that, I mean, there are a couple of things that really benefit myself. For example, the connection or the experience of attending conferences and collaboration with friends internationally, and just never be afraid of presenting yourself and sharing your work with others, sharing your problems with others, because more often than not, we always share the same problem, actually. And so, by sharing our similarities and sharing our work together, we can always help each other. And eventually, we'll be able to resolve a lot of these challenges that facing the scientific community and benefits patients.
Great. Thank you very much, Dr. Mas, and thank you everyone hearing, and we'll see you in the next episode of Immunicast.
Thank you. Bye-bye. Ciao.